I think it is important that we should follow the rules and regulations because it's especially in this industry, in the healthcare, it is about human life. It's not just about more productivity or more innovation.
Welcome to Connected Conversations. I am Elena Petrova, founder and CEO of Adastra Inc. Tune in as we share inspiring stories, connect with local heroes, and discover solutions that uplift us. Welcome to Connected Conversations, where we connect with people and have conversations. Today we are in New York, and I'm talking to Muhammad Atif. We're going to be talking about human-centric technology. We are in the world which has never been so connected and so lonely at the same time. Atif, before we go and start talking about HIPAA, before we are going back talking about AI, I want to ask you a question.
Yes.
And the question is going to be, when was last time you created a piece of software that failed human? And how did you find out about this?
I will say it doesn't fail human, but it has helped the human to expedite and to be more productive, to stay more organized and to achieve their targets.
You have never experienced or worked on software that failed a human?
I think the technology or software building these innovations, the purpose should be to support the human, not to fail the human, to assist them, to make the life easier for them, where we have to put a lot of manual efforts or a lot of calculations, a lot of dependencies on different stakeholders. So the software or any technology or innovation, its purpose, what I think it should be to assist, to help the humans, to make their life easier. It doesn't matter which industry, it can be healthcare, it can be financial, it can be education. So that should serve the purpose.
That should save. That should solve the. I mean, that's the purpose. I agree with you. But we do know that there are examples that software or technology can fail a human. Have you ever come across?
I think, so you can say especially with now, we are all seeing the innovation in the AI. So I think the way the AI is taking over some of the stuff, it can do better job in some places than humans. So this is.
Have you ever across it yourself? Such an example where technology failed a human?
If we take example of a very simple example, like if I have a personal assistant or personal executive whose job is to plan my next week, like if I'm traveling to business conference or if I'm attending meetings, what are the action items that I need to take care. So a piece of software like a bot or note taker, a personal assistant, I think they can do better job than a personal assistant one, having a human over there. Yeah, I mean, very simple example. I mean, then there are a lot of different examples as well.
Okay.
Yeah.
Well, now that we are going to be discussing a project, I saw your podcast November 2025. That was very interesting. So let's say HIPAA. How would you be? HIPAA is on place for a purpose, right?
Yep.
So a lot of my listeners, they are not technical people.
Yep.
Could you explain to 7 years old, as if I am 7 years old, what is HIPAA?
In simple word, Elena, HIPAA is to protect the patient information or about their medical history. So, a patient have their personal bio information, they can have medical history, they can have laboratory details or medication that they are taking or allergies they have. So all this information is very private to that patient. So HIPAA says without the consent or without, if I don't have the right to see that, I can't view that information no matter whatever authority I have. So HIPAA is around protecting the patient and their information.
Thank you.
Yeah.
So you joined your company back in 2006.
Yes.
And when you joined the company, you joined as an engineer first, not a marketing person.
Yep.
What you know about the software and engineering today differently from what you knew back then?
Elena, I will say that the innovation and the way this industry is evolving, like when at that time, 2 decades ago, I started this with my two other partners. So we were the engineers, we were doing the coding. We don't know much about sales, marketing. So we were wearing all these hats at the same time. But over the time, the innovations that I have seen, that in 2007 and 8, we started seeing these social medias like Facebook, Bebo, Friendster, MySpace. And then came the era of mobile applications. Like, we have iPhone released and everyone started jumping towards mobile application in 2010 to 2012 to 15. Then the cloud era came. Everyone started talking about these cloud stuff like Amazon Cloud, Google Cloud. And then we have started seeing word about AI, machine learning. And now this is the wave where we are seeing these automation and you can say agentic revolution, where we are saying that replacing the human with the digital employees who never tires and they can keep working. So it's been cycle. I say it's an innovation cycle that happens every few years, and you need to keep reinventing yourself, in simple words.
Thank you.
Yeah.
A lot of changes indeed. Tell me about the prototype that you built. The one that you built, I believe it was OpenAI, with the API that you built. And what did it actually do? What was that project? What was it for? It was in healthcare industry, correct?
Yeah.
So could you tell me about that prototype?
So it was Elena and actual application that we were building for healthcare industry, specific for 340B space. 340B is a term that is used in the healthcare for eligible patients who can't afford the prescription or care. So government has a special program for them, so they can get like care at a discounted rate. So, but in that like particular healthcare space, there are a lot of regulations and a lot of audit stuff required from the government side as well. And there are different stakeholders like manufacturer, like Abbott or like Pfizer and all these big names. They are selling those drugs to eligible hospitals or covered entities at a discounted rate. And but in the response, they expect that these hospitals or rural areas or special care hospital, they do maintain proper audit as well. That this is, if they are selling the drugs at a discounted rate, they are not being misused. They are properly used for that purpose only for the eligible patient. So one has to, as a hospital or clinic or covered entity, they have to maintain record of like claims. And then the claims are being submitted back to the manufacturer, and then they can reject or approve those claims. So we were trying to build a solution for those covered entities, so they can use the AI and they can make sure that they are following all the government and HRSA requirements, and they are submitting those claims on the time to stay compliant with that program. So we utilize some AI to predict that if a claim is going to be rejected, so we can fix that before submitting. So, but we were trying to use OpenAI or these LLMs that are available in the market. So we ran into the issues that we can't submit this information to any model outside the organization. So after a lot of brainstorming, what we discussed that we will deploy a local on-prem AI solution.
And that one you switched, that you build the prototype, and then you realized that it's not going to pass the HIPAA regulations.
HIPAA regulations
Right?
and a lot of concerns that the information shouldn't leave the premises.
Right.
Yeah.
So, could you walk me through that moment when you realized that okay, it's not going to pass the HIPAA regulations, it's not going to pass the client expectations,
Yep.
and you need to build it on the client's
Yes.
premises, right?
Yeah.
So this is indeed very interesting part. And how did you make that decision?
Yeah.
Because that was a difficult decision to make.
Yes. So, I mean, we were very excited that we built this quick prototype or features very quickly, but definitely we have to see the regulation of healthcare industry. And this particular client was this was one of enterprise client, and enterprise have a lot of regulations and a lot of security guardrails that you have to comply with. And that company was investing into their data centers. They have their own data centers as well. So what we did, that we had a meeting with their engineering department and all the C-level executives and stakeholders. We presented them our solution, and then we listened to them as well and their limitations as well, that what are the rules that they have to follow. So it was really like, I think, eye-opening that, the information can't leave the premises. So what we did, that we changed all third-party or open source, or you can say the OpenAI that we were using with the on-prem model. So we set up that, we built and captured the data points, then we trained that, and we changed a lot of stuff from on-cloud to the on-prem. It was overall great experience, and but at the end we were happy that we are delivering something which is according to the compliance rules, and it's not violating any of the security guardrails.
How did you feel about that decision?
I think that was great, and that was a learning lesson for us as well. And my HIPAA auditor that was part of that team, we already knew that, this is going to be upcoming step. So for the POC and quick winning the trust at how this feature will work, we went with OpenAI. But I think we did have plan to later on make it on-prem. So I'm happy that we adopted that and we delivered according to the expectations.
So you communicated in your, I believe it was Maestro AI podcast I was listening. So in that podcast, you were saying that you ended up with a 70% on-prem version that
yes
accuracy. So can you talk about that number? So I want to understand. So 70% on what? Like, how do you measure that 70% against what?
Yeah. So Elena, the AI, if you are implementing it, it can hallucinate as well. Mm-hmm. You need to keep an eye on that. It can change the results over time as well. So we build evaluation metrics. It's called eval on top of that. That was keeping an eye, just like a dashboard on main KPIs, that what is the input, what is the output, how many tokens are being utilized, and how accurate it is validating those. And we kept human in the loop as well. It's something, especially in the healthcare, that you can't have 100% on the AI end. And then one of the plus point was that, because I told you it was one of the biggest enterprise firm that we were working with. So they had a lot of historical data. That data helped us to make the on-site AI or LLM to be trained to generate more factual results, to have less hallucination. So I think that was a great experience overall, but I'm happy that, it went well.
So that 70, again, I want to understand that 70% against what? Like when you were doing OpenAI, what was the percentage of the accuracy?
Yeah, so on the OpenAI, it was just POC. It was not full product at that time. Mm-hmm. And as I talked about that, we felt, and my already the auditor that I have in my team, they already informed me that after the POC, we will be moving towards on-prem side. And it's the same thing. OpenAI was also having the same or more accuracy, but I mean, it's something you can't release your patient and all the secure information to these LLMs. They can utilize that for other purposes as well. Like, let me give you an example. Like, I was listening to a podcast from TD Bank CTO. He was explaining a major issue that in the financial industry, like most of the enterprises, I mean, it was a few months back. I'm not sure what is the story right now, that people are posting, they have their own personal GPT accounts, and they are posting like secure financial information into the personal GPT accounts and then getting insights and decisions from GPT. And that is against the policy and the rules that fintech industry has or financial or banking industry has. So there needs to be a complete governance and end-to-end AI implementation policy, that you need to have enterprise AI, you need to have security guardrails, who is using what information for what and what information is leaving the premises.
That's precisely,
Yeah.
and that is very interesting data. I'm going to go back to our project here that we're discussing, because that is a lot of good stuff that our listeners can learn from you.
Yeah.
Right? Because again, in my view, the way that I'm learning from it is your team did a sacrifice in accuracy for what, right? Because there is way that humans receiving the security with HIPAA.
Yes.
Right? So again, those 70% that we are talking about accuracy that you are getting with this project, this is hard decision to make.
Yes.
The way that I'm looking at it,
I mean, HIPAA policies are very strict. I mean, HIPAA...
And they are for a reason.
Yeah, I mean, HIPAA says privacy, security, any kind of breach, it should be notified on the time. Privacy means, like, even if you are the project manager or if you are the code developer, you can't see any patient information without consent. I mean, you need to have proper process followed. So how we can give any patient information to an AI model which is not owned by us and it is third party? And then if you look at the penalties of the HIPAA, I think it has huge 5 to 6 figures of fines and then jail time as well if they figure out that there was any such breach happened and it wasn't taken care on the time. So keeping that in mind, I think one has to be very careful while utilizing these AIs and all these innovations, that we are not like innovating something on the cost that we are violating these rules.
Correct. And now we are looking at 30% points, that 30% accuracy, right? In healthcare context. And that is a lot of...
Yeah. So, Elena, because we just shipped that product at that time, so that 30% gap will be filled over time as we get more data. It was about claims data. So as we get more claims data, we will have more hypotheses and more like statistics to train the model. It will increase its efficiency over the time.
And so that's my next question. So now that you have, that 30% percentage points that we have, right? So what can the cloud version do on-prem now that you learned on this project?
Yeah, so this is what I'm saying. Like, I mean, AI keeps learning over the time.
Right.
So as we went into the production, we started getting more use cases, more data. So that 70% is not a fixed number. It will increase over the time. We may have already reached out to the threshold of 80 or 85% plus, and it will keep improving over the time. Yeah.
Yeah. So there are a lot of conversations that are happening right now in this country, right? And when we are talking about that compliance is an enemy for innovation, I hear that a lot today. And when I heard your podcast, I thought that you are the CTO that lived through it. You are the one who made that decision.
Yeah.
So in your opinion, what is the right rate?
I think it is important that we should follow the rules and regulations, because it's, especially in this industry, in the healthcare, it is about human life. It's not just about like more productivity or more innovation. We have to make sure that the data and whatever innovation we are bringing, it doesn't like play with the care that we are all getting, right? So I think rules are there, and these regulations sometimes makes the things more streamlined, and it gives us another, like you can say, thinking point that we should maybe innovate keeping these regulations in the mind as well. I don't think it's hindering any kind of innovation. And you may have heard that US government just, I think they were saying this week that they are going to make a governing body. So if any new LLM is being launched, it will be reviewed by that governing body before it goes to the end consumer or end business's hand. And I see a lot of backfire over there as well. People are saying it's going to hinder the innovation and all these speed that we are having. They are selling another fear that, I mean, if we put these governing policies over there, China may be ahead of us in the AI game.
What is your opinion? How do you know when to make that decision, whether you're going to sacrifice going forward fast and where you need to slow down to make sure that humans are protected?
I think having a governing body will make the things more streamlined, because there are some gray areas or black areas we don't know about these companies. Especially, you may have seen with the Anthropic, they released Mythos few weeks ago, and they said that they have released it to the limited number of vendors, and it is so dangerous that if it goes to the wrong hands, they can bring the governments and banking system down within few hours. I mean, it can like break all the like security guardrails. But on the other hand, I was like reading an article that Mythos, the hackers had access to the Mythos LLM the day it was released already. So I think having a governing body on top of that will make the things more streamlined.
I'm curious, you Atif, when you are making your decisions, how you're going to be made?
Yeah.
How, what's your decision process when on your project you need to know when to slow down and when to put the foot on gas and move forward?
Yeah, faster? I think for us, Elena, like especially because we mostly work in healthcare industry. So for me, if I'm in the healthcare, building any software, for me, the regulation, the compliance is always top priority, because I can't like compromise on the security or any kind of compliances that healthcare requires. But if it is some other industry where we don't have much compliances issue, accuracy does matter. Like I will try my best to have top-notch tools or top-notch technology to build that particular technology. Yeah.
And for some of our listeners that are listening to us right now, what questions, in your opinion, they should be going and asking their CTOs or their tech teams?
Yeah, I think they should be, first of all, focusing like the problem that they are trying to solve, what industry does it belong to, and then they should try to bring best of the best solution for that particular industry. And right now, everyone is having fear of like, I mean, AI is replacing the human, but at the same time, it is fact as well. I mean, lot of jobs, lot of roles that can be automated through those agents. So I think following the smart approaches and following the best guidelines while building any product, that should be brainstormed and put into the plan before starting or delivering anything.
And going back to the project that we are talking, what is the biggest lesson that you learned from having a trade-off in a way to slow down? And then you're saying that you still the on-prem version is improving, right? But originally it was a trade-off.
Yeah.
one way or another. So what did you learn from it?
I think what I learned that for enterprises and big firms like Fortune 500, uh, their processes does matter. Their rules, regulations, boundaries does matter. Versus if you are working with a startup, for them, the productivity, the frequency, and shipping as soon as possible does matter. And the difference comes here that startups, they are always struggling with the funding and they have limited funds, limited resources. And they are right on their part. I mean, they have to pivot, they have to see what the customer respond to the product. They need to ship quickly to the market. They need to find like market fit at the as soon as possible, and they need to adjust their strategy. But for enterprise, I think they don't have any limitation on budgeting side, on resources side, and they wanted to make sure that the product that they are building are following all the best practices, architecture level, enterprise level architecture, compliances, and it doesn't get into any trouble on any end.
And what about you personally? What you learned from it?
Yeah, this was like lesson. I mean, when you are working with like enterprise, you should always keep in mind the compliances and regulations. Versus if you are working with a startup, you should focus on speed and quick delivery.
What about you personally? I'm curious. You
Personally,
as a person, Atif, what you learned? Because I'm. This is the first time we are all dealing with the open AI or any other open source sources, right? Just even
learning
so,
from
like 2 years ago, we were not able to build anything like this.
yeah,
Now that was the opportunity. You build, prototype, then you couldn't implement it, so you had to pedal back
yeah,
and rebuild it with the 70% accuracy.
yeah,
That slowed down.
yes.
So that was a trade-off. However, you moved forward with this. I'm curious your personal decision-making process, what you learned from it. Because there is a lot of listeners that want to get your experience and build on it.
I think it feels a bit frustrating at that time. I mean, you see that, okay, it's something you have built or shipped, but it is not going to production. But at the same time, like, it's a lesson that sometimes setbacks happen for a good reason. Because at the day end, it was following the compliances and all the best practices that a product like that should follow. Yeah.
Was it difficult?
Yeah, it was quite, I mean, you can say difficult, especially the team who has been working day and night to ship that particular feature. And yeah, it was, but I think we had a few sessions internally. We tried to regroup, re-brainstorm, and try to get everyone on the same page. So it was a bit slowness and bit downtime for the team, but we recovered that area time as soon as possible and were back on the full throttle.
How did you communicate it to the team that we are going back?
Yeah, so I know it was one of the like demo meeting, and it was on Friday. It was weekend. Everyone was feeling like excited that we are going to demo this feature and then we are going to have a relaxed weekend. But right after that, like, demo went well, everyone appreciated, but right after that we got an email about compliances and we can't use this open AI and everything. So at that time, I mean, I called the meeting with the execution team. I had my head of engineering, my scrum master, my rest of the developers. So we call it town hall meeting. At that time everyone was there, and I started with this one. First of all, like, I tried to build a momentum that we did a great job, we delivered this thing and that. And then I told them that, okay, it's the decision, something that due to the compliances and security we have to make. So I think my team understood this. And as I mentioned, that we are in the healthcare and they know these compliances and everything. So they understood this as well and took it as positive. Although it slowed down the progress for a few weeks, but we were back and we recovered out of that period.
Yeah.
Yeah.
Interesting. And now that we are learning from you, and the last question I suppose I have before we start
Yeah.
widen this conversation. So now when you talk to or you hear other companies talking about their claims in healthcare, and there are a lot of them are talking about AI right now.
Yep.
I just finished the conference here in New York about agents and AI. How do you know the difference when it is a marketing speech or it is a real solution that the company is talking about?
Yeah. So I think if it is delivering the value, if it is like really adding or speeding the care for the patient, like I think it is adding the value, then it is the real that they are delivering. But if it is making the things more complicated, like when you walk into a clinic as a patient and you have seen the staff member try to fill in the forms, it take 10 to 15 minutes, and then you go through another round. Then the doctor or provider comes and then they also try to fetch all these notes and type. So if it is adding more clerical work or data entry and adding more layer of complexity, more work for staff and clinic, and not giving all the visibility to the doctors and providers to best prescribe as a patient to you, I think it's not adding any value. But if it is making the life easier as a patient, I'm getting care on time without a lot of paperwork, lot of miscellaneous step. And as a doctor, if they are able to fetch all the information as a patient about me, my bio, my allergies, medication, my lab reports, my history, and they are able to make decision instantly, I think that is really adding a value. And that kind of agentic or AI or data layers we need to build out. And Elena, there are EMR, EHR, which are built on a legacy system. We can call it legacy or old outdated system.
But what are those?
Yeah.
And let's pedal back a little bit, because when you say value, when I meet with some of the companies that talk to me about their solutions for, well, right now we're talking about healthcare, right? For healthcare, again, there are a lot of claims about accuracy. There is a lot of claims of what they can or cannot do. Again, for someone who is not technical,
Yep.
sometimes it sounds too much, right?
Yes.
Too much. And like, I don't know how to make a difference between marketing spiel and a real world solution.
So
that brings value, as you are saying. So can you give us a little bit of, me and my listeners who are not technical people, a little bit of, I don't know, a test, a screening test. What is marketing and what is a real world solution?
Yeah. So this is what the point that where I was coming. If it is adding more time to get care as a patient, if it is adding more complexities for clinical staff, if it is adding more layers for the provider or doctor or surgeon or physician, it's not a real value.
But that's the problem, is that when you are listening to those...
So the time is the metrics. Time. For a patient, I need to get care on time. Like if I walk into any clinic and they say like we are using all the best technology and everything, but then you have to wait 10 minutes next to the clinical staff, they are doing all the data entry and they have...
No. That, I think you misunderstood me. My question is, when I'm talking to companies like yours, and they're saying, okay, use my solution, and we will resolve all your problems. And our accuracy is like 99% in solving claims. And how do I know that it's real value they're bringing on, not just a marketing call?
So I think that maybe you can ask for like some real-time customer references or some real-time value that they have added. And when you see the people are doing good work, you may see their like reviews. You may see like who are their customer who are using them.
Is there any particular questions that I can ask them?
Yeah, so I think the particular questions can be around. Again, I mean, there are so many verticals. I mean, it depends upon what kind of company you are talking about. Let me give you an example. Like I'm working with a company who are trying to solve problem for third world countries. Every patient can't get a care, so they are building a mobile application that can take the picture of the iris, and it can like from the eyes can detect if the patient is affected with malaria or not, right? And they are testing that. So I see something they are adding as a value. Similarly, another company we are working right now, they are trying to solve problem for the police has when they stop any driver for like if they are affected or if they are like having affected right now, so they go through a test and everything. So we are building an application which can monitor the heartbeat through mobile application by putting your fingerprint and also the movement of your eyes, and there are some other factor in the algorithm as well, and that can tell if the person is affected right now or not. So these kind of problem which are really like adding value and can be tested right away, I think these things should look for. Like another example I can give you is
Okay, I get it. So
yeah.
those ones bring value for sure.
Yeah,
How do I know if their data is accurate?
I think that depends on the usage. I mean, the real customer feedback is the only right metrics that can tell you. I mean, I can have any marketing messages, any number of stats, but the real feedback is from the customers or testimonials that are using. And sometimes it may be that these solutions, doesn't perform up to the metrics due to continuous innovation. But again,
And how do I know that they are not using open source or they are all following HIPAA regulations? Is there any way for me to ask those questions?
yeah, so I mean, whoever is selling you the solution, they need to have those if the solution is HIPAA certified or SOC 2 certified or ISO 27001 certified, they need to have those particular seal, and you can verify those. If they are not following any of those, I mean, as I mentioned, there are a lot of like penalties and it can be really problematic for them.
Okay, so we are going to be looking at HIPAA and SOC 2, you said.
SOC 2, it depends upon like if it is a mix of hardware and software, then there comes FDA compliance as well.
Okay.
If it is about prescription management, then the short script certification comes over there, or German certification comes over there, EPCS certification. So there are a lot of different set of certifications. HIPAA is for everyone, but then there are certain certification for what particular market you are trying to solve your solution, and that solution should be certified for that particular niche as well.
Okay, interesting.
Yeah.
All right, thank you. And in general, I am curious for your opinion. What conversations we as community, society, should be having more today?
I think we should be talking about that how we can keep the human in the loop with all the innovation that is happening. Because I mean, one of the debate is that if like AI agents or digital employees is going to do everything, then what will be the purpose of the human? Like, I mean, how they will find the purpose in the life? Right now, we know that, I mean, we work and it's a purpose driven, and then like we can do this and that. But on the other hand, we have seen the conversation about universal basic income as well, UBI and all that. So this is something that is debatable, and I think where we should talk a lot about how to figure out the next steps.
Thank you very much, Atif. That was
Thank
a pleasure
you, Elena.
talking to you.
Nice to be on this conversation, and thank you for inviting.
Well, thank you. And thank you joining us on our Connected Conversations today. That was human-centered technology with Muhammad Atif here in New York. Thank you.
Thank you, Elena.
Thank you for tuning in into Connected Conversation. We are incredibly inspired by the potential of positive change within our communities. We invite you to be a part of our conversation, and we invite you to be a part of our journey. Please subscribe to our podcast to stay updated on our latest episodes. Your support is incredibly invaluable. It will help us to grow our community. We also encourage you to share your thoughts in the comments of each episode. Your feedback will help us to create even more meaningful conversations. We can inspire the change and connect with each other one conversation at a time.